Wondermous, welcome. My name is Merikay Hunt, and I host a podcast about leadership, healthcare journeys. And the last several weeks, we have met some very incredible people. And today we have a guest that is inspiring on many levels. So, Karthik, please take a moment to introduce yourself to our audience and share with them a little bit about your background.
Sounds good. Hi, Mary Kay. Nice meeting you again. Karthik Ganesh. I've spent the last 25 plus years in healthcare. I'd like to think I've touched healthcare from all of the angles that it could be touched from.
Mm.
Where I am right now is I'm the CEO of OnMed. And for as incredible as my healthcare journey has been, as incredible as my professional journey has been, and I feel very blessed for it, I feel for the first time in my professional career, my work has met my soul.
Oh, I got goosebumps when you said that. Tell me more about that. My work has met my soul.
There is nothing more purposeful than helping improve the quality of life for other people.
Mm.
I tell my kids all the time, if you were to ask one of my boys, be and just pause right there, they would say, be a giver, not a taker.
Mm.
This OnMed and the opportunity we have with OnMed in terms of bringing healthcare access into underserved communities across America as a starting point is it is just so purposeful, Mary Kay. It just feels it feels like I'm doing exactly what I was meant to do.
Right. Wow.
But more importantly, it feels like this is going to be an oversized part of both my personal and my professional eulogy.
That's amazing. So before we started, I mentioned to you that I watched a powerful video about what OnMed was on your website. So describe what OnMed is for people so they have an understanding.
Of course, OnMed is the problem we're solving is healthcare access.
Mm-hmm.
There's 120 million Americans who have little to no access to care. Over 80% of our counties as a country have one or more healthcare deserts.
Mm.
Anyone who's tried making a doctor's appointment knows you can't get a doctor's appointment for 3, maybe 5, 6 months in some cases.
Right.
Anyone who's tried going to the ER realizes two things. One, there's a lot of people at the ER who are there for non-emergent reasons.
Absolutely.
70% of the people who go to the ER are for non-emergent reasons because they have no place else to go.
Right.
And as a result of that, you go to the ER and you end up sitting in, if you have an emergent reason, you're still sitting out there for 4 or 5 hours at a stretch, maybe more in some cases.
Sure.
We look at the way care has historically been delivered. That's really been two modalities, and history has a recency to it and a longer term perspective to it. One has been our traditional brick and mortar clinics. We are running out of doctors as a country. We needed 200,000 more clinicians as of 4 years ago. We're producing 17,000 a year.
Wow.
Setting up a clinic
Not
and standing up,
sustainable.
not sustainable. I mean, we've hit a ceiling, and there is nothing that's happening to change that dynamic. The clinics are very expensive to stand up and administer as well. So then we go through COVID and we get excited about telemedicine. But telemedicine has some, for the rapid scalability that telemedicine offers as a strength, it has some gigantic blind spots. 75 million Americans have less than viable access to broadband. 1, 2, 3 Mbps, or no broadband at all in a lot of cases.
Wow.
When you've got no scans, no biometrics, no diagnostic tools, it really is a phone chat with a provider. From a clinical experience standpoint, it is not a clinical consult, right? And that's where OnMed comes in. We've understood, anyone who I think says, well, if you could just do healthcare over, how would you do it? I think it's a flawed question. You don't do over a $5 trillion industry.
Right.
Right. You've got to take what works, you got to amplify what works, and you have to neutralize what does not. No different from an industry, a company, a human being. They all have the exact same ways to to evolve. You
Sure.
amplify your strengths, you neutralize your weaknesses. What we've done with OnMed is we have taken the best of in-person brick and mortar care, which is the comprehensiveness, the confidence, and the comfort that a clinic offers.
Mm-hmm.
We've married that with the rapid scalability of telemedicine. And
Mm-hmm.
what we've created are care stations. Each care station is an 8 by 10 clinic in a box.
Okay.
You walk into it or roll into it based on whether it's wheelchair accessible.
Mm-hmm.
And you can basically get most of what you would expect from a primary care visit or an urgent care visit and most post-acute.
Right.
87% of anyone who walks into the care station does not need a specialist consult. So it is that comprehensive. We have,
Right.
now it comes back to the soul component of it. We have rolled this out. This has not been a, we have rolled this out across rural America, suburban America, urban. We are in a prison. We're in a homeless shelter. We are in rural West Alabama and West Texas, where um, healthcare is as big of a challenge as power and water, right?
Wow.
Things we
That's
take for
power. That's a
granted.
powerful statement right there, Karthik.
It,
Huge.
there's things we take for granted as a
Right.
country, and if 120, I rattled off some numbers, Mary Kay. If 120 million Americans had rolling power outages, if
Mm-hmm.
80% of America had inconsistent running water, we would be up in arms.
Mm.
Yet neither water nor power are as personal to us as our health.
Well, I
And we
even
have
see
120
this.
million. Yeah,
Absolutely. I even see this almost as a remedy when there's a natural disaster. Because
it is. It
what I
is.
want people to think about is visualize like a photo booth that marries with, a small operatory. Okay. And that's what it seemed like to me. So it had
That's
the
a good way to
visual
put it.
component. It looked like it had a blood pressure cuff. So tell me a little bit how it's equipped.
Yeah, it has blood pressure. It has a blood pressure. You walk in, you stand on the scale. The bulk of the floor is the scale.
Mm-hmm.
65-inch screen in front of you.
Mm-hmm.
We've made it super easy for a person to use it. You press start, you go, the clinician shows up, the door shuts, the glass fogs. You're now in a private, secure,
Nice.
soundproof environment. There's thermal cameras, thermal scans that are checking for your temperature. There's infrared cameras that are looking for congestion. You can see your heat. You can see the heat maps on your screen in front of you. It's looking at your forehead, your chest. It's
Mm,
looking to see where the congestion might be. The clinician, there's a blood pressure cuff, there's a pulse ox. The clinician can deploy a stat. The clinician can deploy a high def camera
mhm.
based on what needs to be seen. I got a rash, I've got a bee sting, I've got a sore throat, I've got a ear infection, I've got a sty in my eye, I've got
Right.
sinusitis, I've got a cough. Whatever the case might be, the clinician can listen to you. It is you, the clinician, on a 65-inch screen, so she feels like she's right in the room with you with all
Absolutely.
of these devices. So you are in an entire ecosystem that feels like a clinic,
Mm,
yet it is personal, it is hygienic, it did not require an appointment for you to walk into it. And for most of the country, it's free. The places we've
wow.
deployed this, it's being provided as a service. And we've had people, especially in some of our rural communities, we've had people just walk over to people on my team and just give us a hug and say, "You saved my life." And
Wow.
even if we did that once, that is one more than most people have the opportunity to do in their lifetime. And
Absolutely. Well,
to do that as a part of work,
I'm
it's
even
even
thinking of
cooler.
the small mountain town that my father grew up in Burton, West Virginia. It doesn't even have a stoplight. And, this is the coal mine country of West Virginia. He grew up on a farm and, you know, think of the access there or the
Right.
lack of access. And
Absolutely.
so one of the things that really hit my heart is the ability for this to reach people that wouldn't have access otherwise. And so how do you envision the growth of OnMed, and how can we help get the word out about it?
I appreciate that, Mary Kay. We're in 7 states. We're entering Puerto Rico. we were very, very fortunate with the fact that with the rural health transformation bill that just and the program that just that the administration rolled out, and the $50 billion that's being pumped into rural America, um, we were called out by name in the application based on what we're doing with Auburn University in West Alabama as
Okay.
an example of what rural health transformation could look like in America.
Sure.
Um, so we so clearly, as it pertains to rural health, we feel like we're on a path at this point in time. This is Merikay, I think as you look at it, right, anyone who goes out to onmed.com and looks at the video
Hmm.
will realize the applicability of this is just tremendous. We
Couldn't
are
it even
deployed.
triage outside of a hospital?
It
I
could
mean,
actually be
couldn't that
deployed.
be possible?
It could be deployed inside of an ER. It could be deployed right outside of an
Exactly.
ER, and it should be. So whether you're a provider, you're a hospital, a health system, whether you're an employer, we've deployed this. We've deployed this at one of the largest, at the largest employer, quite frankly, in the state of Georgia, which is the Georgia Employee Health Plan.
Hmm.
It helped with absenteeism. It's helping with their wellness adoption. It's helping with um, reduction in ER visits, which are a significant,
Hmm.
an oversized percentage of an employer's spend. If you're an employer, if you are a university, if you are a health system or a hospital, if you're a local, state, federal government, there is really, if you're a payer, there really is no aspect of access. If you have an access problem, OnMed is your answer.
Well, you could even station it. I think I'm getting so excited about this because I was thinking about when I would round in the emergency department, and it would break my heart to see people suffering and sitting there for so long. And then I'm thinking about these large companies that I've taught for over the years. Couldn't we have one at these large organizations so
Absolutely.
that they wouldn't have to leave work to go to
That's
their
exactly right, Mary Ken.
medical appointment?
That is the absenteeism play for employers, right? I mean, we're again, the state of Georgia, their employee health plan has deployed this. It's in the Capitol building in Atlanta. They're looking to
Mm,
deploy this across the city, but it has been tremendous. I mean, it is, you know, healthcare for employees and wellness programs for employees have been around for a while. But I mean, employers pick up 80% of the commercial premiums in this country.
right,
Healthcare has never been a field of dreams. If you build, they will not come. You have to show up where people are because they can't
right,
leave work to go and do things
right.
outside of it. To your point, you put this inside of their primary workflow. So now, for example, employees who are entering and leaving the building as a part of their
Mhm,
workflow, this is right there. So when
mhm.
the HR teams want to have wellness campaigns, know your numbers campaigns, people can't say, well, do I work or do I do this? No, it's
Sure.
you're walking into work. Go step into the care station, take care of, know your numbers, and then walk over to your desk, right? Um,
Absolutely.
there is an ease to it. There is a fluidity to the experience.
Mhm,
There is a comfort. There's 37% of the people who come to the care station are repeat visitors to the care
mhm,
station. So we know we're building we're not just giving them a comfortable experience, we're giving them the psychological confidence to come back because they
mm,
believe they got the right level of care the first time around.
sure.
78% of the people who've walked into the care station have told us we are their medical home. They have
Mm.
no place else to go.
Well, and let's
53%.
talk about that for
Yeah.
just a second
Yeah.
because I went and had to get me some tissues because I got a little emotional about sharing a couple things. One is I do live in Southport, which is the area where we had the murder take place at the American Fish Company, and they discovered that the gentleman who pulled the trigger on this mass shooting and killed 3 people and injured, I think, 8. He was a decorated Marine veteran, Purple Heart recipient, but he suffered from PTSD and he had a brain injury when he was in combat. And so it made me wonder what if, because our VA hospitals, I used to have a coaching client that ran a VA hospital, and one of the things that was access, right? So it made me think, okay, Karthik, could this help people in our military who are, are retired or been discharged or whatnot? Could this also help people with addictions?
Yeah.
And, that's something else. Our
No, no.
mental wellness facilities, they're closing up. They closed the mental clinic when I was working at the hospital, and then same thing. We don't have enough help for people that are suffering, and I think that's what I see is his potential could be so supportive in so
Hugely,
many
hugely
ways.
important. And I will tell you, so one, we do mental health screens today, but in the next 6 months, we're going to very aggressively enter the mental health space. And I will tell you specifically why this would be different and why this would be a game changer. You talk about addiction as an example, and you've shared your personal journey with me, and from a family standpoint.
Mm-hmm.
What we continue to find with addiction is the single largest barrier to receiving care is the stigma associated with it.
Right, right. And people need to know it's strong people that seek help.
That's
And
right.
that's what the
That's
messaging that
right.
I would love to shift.
That's right. But
Yeah.
assuming the psychological shift does not automatically happen, because we've been trying to say that for a while, but it hasn't quite resonated because the stigma is not going away, unfortunately.
Right.
Where I see the advantage of a care station is you walk into the care station, the glass fogs. At that point, you could be there for a bee sting,
Mm-hmm.
or you could be there for a mental health consult.
Absolutely.
There is a there is a neutrality, there is a comfort, there is a privacy to what happens inside of the care station that allows you that would really enable a person to feel comfortable seeking the right level of mental health care.
Mm-hmm.
And so over the next 6 months, we are very aggressively going to enter the mental health space, and I would fully expect that addiction is one of the first areas we go after because um, I had I live in Connecticut,
Mm-hmm.
in Greenwich. One of the largest um, addiction related programs is Shatterproof, which is based out of
Mm-hmm.
Connecticut. And I'd spoken to the founder at one point, and he'd said, Karthik, I mean, the stigma is what is holding these kids back, and
Mm-hmm.
um,
And
we
suicide
have
prevention.
suicide prevention
That's
as a
another
result of
thing.
that.
Our youth,
Yeah,
later stats that I've seen, it's astronomical. I don't know if social media has a big role in this or if COVID had a big impact with the isolation, but that to me is terrifying that our young
100%. I mean, we have
people.
seen an oversized percentage of suicide ideation, even in
Mm-hmm.
people that you see as you who at face value appear to be perfectly in control of their faculties. Mental health is a huge opportunity for us, Mary Kay. We're trying to be very smart about, as you can well imagine, is the use cases on this are so tremendous.
Mm-hmm.
It is incredibly important for us that we are very deliberate about each area we enter
Right.
because we want to be extremely impactful
Sure.
and deliberate about what we're doing because we don't want to do a lot of things and do them in a very average manner.
Right.
So when we enter mental health, which we will very quickly now, we want to be pristine at it. We
Mm-hmm.
want to make a difference. We want to be seen as the de facto answer,
Mm-hmm.
a solution for the stigma associated with it.
Mm-hmm.
I
Purposeful.
personally,
That's the word that's
purposeful.
coming to my mind is
It is
purposeful.
purposeful. I personally want OnMed to be a verb.
Mm.
As people think about physical
Mm.
health, as people think about mental health, the question is, did you OnMed?
Oh, I love it. I love it. Absolutely love it. And, I think too, the other thing that I love is that you mentioned two things: care and safety. Those are two qualities that every patient wants. They want to feel cared for and they want to feel like they're in a safe environment.
Exactly
And
right.
the privacy component of it, not having to deal with the stress of dealing with all the people that you interface with when you go to a clinic or when you go to the emergency room. I just see so many blessings behind this
Absolutely.
initiative.
There is nothing more important to the patient's psyche than the word trust.
Mm, mm. So
And
I
you're
want to
exactly right.
highlight. I noticed the happiness.
The
Um,
happiness model.
Tell me about that. Yeah.
Yeah. So, about 12 and a half years ago, I lost my daughter to cancer.
Mm,
And I had a lot of questions, as you can well imagine.
sure.
And I found a lot of the answers were within versus without.
Mm.
And so about 12 years ago, I started my my journey within. And at the end of the day, happiness is not a destination, right? It is, quite frankly, it is a journey.
Absolutely.
And it comes from a place of inner calm.
Mm-hmm.
It comes from a place where you can very quickly transition from a what to a
Right.
so what.
Sure.
And so, in a lot of ways, happiness is about resilience. It is not about, and that resilience is what the book is about.
Mm.
It is about, I've taken my own personal journey and talked about um, the things that I continue to work on
Mm-hmm.
to build that inner anchor out, and the resilience that goes with it. And you could call the inner anchor God, you could call it faith, you could call it universe. You
Sure.
pick the
Mother
term
Nature, whatever you
Mother Nature,
choose.
whatever you choose, or just love, right?
Absolutely.
Whatever works. But there is nothing more permanent than change.
Mm.
And in all of the change, of all of that change, the only thing that is truly permanent is that inner eye.
Yes.
Because you're a toddler, you're an infant, you're a toddler, you're a teenager, you grow into an adult, you keep evolving, but
Mm-hmm.
evolution has to be with respect to a static point. It can't be with respect to something that is also moving. And
Mm-hmm.
that static point is that anchor within. That's
Mm.
the only part of you that is observing this evolution. Now, if you find yourself, if you can find it in yourself to be drawn to that anchor,
Mm.
you start looking at things that happen to you as you don't
Mm-hmm.
take the things that happen to you personally. You
Mm.
start looking at them with a level of dispassion because you almost see them as something that's happening to someone else.
Mm.
We seem to be so amazing at giving other people advice, but we don't take any of it ourselves.
Wow.
What if we actually took that advice ourselves and we just honed in on that anchor? Again, call that
Mm.
anchor what you will. And that's what the book is about. And it's been a core part of my life. It has fueled my personal journey. It has fueled my leadership journey, and
Mm.
it's just who I
Thank
am.
you. Thank you for sharing that. Actually, I don't know if you can see it, but I have an anchor on my
Oh, you do? How
necklace. I
sweet.
do. Yeah.
Oh,
And
that's very sweet.
um we'll make sure and put in the summary how people can access your book.
Okay.
Thank you for sharing that about your daughter, and
Thank you.
thank you for listening to me about my family member that's struggling with addiction, and it's touched a lot of our family in many ways. And I think, as we've mentioned in our conversation before we started recording, compassion,
Yeah,
right? Compassion and understanding. And I think making that shift, whether choosing joy, choosing happiness, choosing to be compassionate, choosing to even take a difficult, tragic situation like we had here in Southport with the shooting,
yeah,
and looking for the blessings behind it, looking for the gratitude, looking for the opportunity that today is a new day
absolutely.
and I've got an opportunity to do something different. So I can't wait to learn how I can continue to support and help you all on this quest. But to stay with one of my favorite questions as we come in for a landing here, if you could talk to your younger self and give yourself words of encouragement or wisdom, Karthik, what would you say?
I would tell my younger self to not take life so seriously.
Mm.
I would um, I would tell my younger self to trust in the universe. We think there's so much we control. We actually don't control. We don't control very much. We don't control the past. It's already gone. We don't even control the present because it's
Mm.
already here. But
Mm.
what we do control is how we respond to the present.
Absolutely.
And I would tell my younger self to be more present than living either in the past or in the future.
Mm. Thank you. Again, Karthik, this has been just transparent, true, and loving and kind. Thank you.
Thank you.
Again, my name is Merikay Hunt. I'm founder of Coach MK Companies. We're a firm dedicated to helping people rise and go to that next level with their leadership and their teams. I hope that you'll check out OnMed and go take a peek at their organization. And if you can be a champion of change for them, please do. Blessings to each of you, and make every day count.